So, you sent over some information, and it really made me take a second look, about what's happening with cancer cases in India right now.
Yeah.
And the figures from the ICMR National Cancer Registry Program are, well, they're quite startling,
Yeah.
frankly.
Yeah.
So, for today's deep dive, that's exactly what we're going to unpack here today. Get a much clearer understanding of what's going on based on all this data you shared.
Yeah, I mean, getting a handle on this is so important, especially, when we're talking about a country as vast and diverse as India, right?
Mhm.
These stats paint a really significant picture of, the nation's health, and trying to understand what these numbers mean, is really that first step.
Absolutely. And, the very first thing that kind of jumped out at me, and I'm guessing it probably did the same for you when you first saw it,
Yeah.
is just how concentrated these reported cases are in just a few key states.
Yeah.
Uttar Pradesh, for example, is leading with a very significant 2,010,958 cases.
Wow.
Then you've got Maharashtra with 1,021,717, West Bengal at 1,013,581, Bihar with 1,009,274,
Hmm.
and Tamil Nadu with 93,536.
Right.
So when you add all that up, these 5 states account for a huge proportion of, the overall situation.
Absolutely. And that kind of geographical clustering, it sparks a lot of questions immediately. Like, are there specific regional factors at play here? Could it be, the way the data is collected is more robust in some areas than others?
Hmm.
It's definitely a starting point for some much deeper investigation. But even on the surface, those numbers are just hard to ignore, in terms of the burden on those specific regions.
For sure. And, if those current numbers weren't enough to make you think, well, let's look at where things are projected to head.
Okay.
By 2025, that's just around the corner, really.
Right.
The estimated total number of cancer cases in India is expected to reach a staggering 15,069,793.
Wow.
But get this, by 2040, that figure is predicted to jump to a really concerning 22,018,694. That's a massive increase in a relatively short amount of time.
It is. And those projections really underscore the urgency of this health challenge. We're not just dealing with the situation as it stands today. We're looking at a health issue that's rapidly growing.
Right.
These kinds of numbers have huge implications, for the healthcare system's capacity, the financial impact on families, and most importantly, the really profound personal impact on the individuals and their loved ones who are affected by cancer.
Absolutely. It can almost feel like this is a problem unique to India, but when you kind of zoom out and take a global view, it puts things in a slightly different perspective, although not necessarily a less worrisome one.
Right.
India currently ranks third in the world when it comes to the total number of cancer cases.
Yeah.
Sadly, China tops the list with a massive 48,024,703 cases,
Wow.
followed by the United States with 23,080,189.
Okay.
So while the numbers you shared with us are high, it's clear this is a global health concern.
It is. And putting, India's situation in that global context, I think it's so important.
Yeah.
It tells us that the underlying factors, that contribute to cancer prevalence, they're complex and they're widespread. They extend far beyond any single country's borders.
Yeah.
And while each nation's undoubtedly going to have its own specific challenges and contributing elements, this broader perspective really reinforces the idea that research preventative measures, treatment strategies, they need to be a global priority,
Right,
with shared knowledge and collaboration.
Okay, so we've laid out the current picture as revealed in this data. You sent me the states with the highest numbers, the concerning projections for the years ahead, and where India stands globally. So now let's try to understand the why behind these increasing figures.
Okay.
It can't just be bad luck, can it?
Not at all. And the information, you provided from the ICMR actually points to several key factors that are likely contributing to this rise. And the first one may sound a little surprising. It's actually better diagnosis.
No.
Think about it. With advancements in medical technology and the expansion of screening programs, we're now able to detect cancers that in the past might have gone unnoticed or been diagnosed at a much later stage. It's like upgrading from an old black and white TV to a high definition one. You suddenly see a lot more detail.
That makes a lot of sense. So in a way, the increase in the number of reported cases is partly a reflection of progress in our ability to find them.
Exactly.
It's like finally getting that persistent leak in your house fixed. The problem was always there.
Right.
But you just didn't have the right tools to identify it properly before.
Exactly. It's a really crucial distinction to make. While the rising numbers are undoubtedly a cause for concern, a portion of that rise likely reflects improvements in, how we monitor and diagnose cancer.
Right.
And this increased detection can actually be a good thing in the long run, as it allows for earlier intervention and, in many cases, significantly better outcomes for patients.
Another factor that the ICMR data highlights is that people are living longer.
Yeah,
And while this is fantastic news, a real testament to advancements in healthcare and overall quality of life,
absolutely.
it also means that people are living long enough to potentially develop conditions like cancer, which are more common in older age.
Right. That's a fundamental aspect of biology and aging. Cancer often arises, from the accumulation of genetic changes in our cells over time. So, as average life expectancy increases, unfortunately, we would expect to see a corresponding increase in age-related diseases, and cancer is a prime example.
Right.
It's a bit of a double-edged sword, a success of modern medicine leading to a different set of health challenges that we need to address.
Then we get to the factors that, to be honest, feel a little more within our control.
Okay.
Lifestyle choices. And this is where it can get a bit uncomfortable because we all know the usual suspects: smoking, excessive alcohol consumption, not getting enough physical activity, and those increasingly common sedentary habits that so many of us have fallen into in our modern lives.
Yeah. And the impact of those lifestyle factors on cancer risk is significant.
Okay.
They contribute substantially to the likelihood of developing various types of cancer. And it's about, the long-term cumulative effect of these choices, creating an internal environment within the body that is more susceptible to, the development and growth of cancerous cells.
And we can't overlook diet. The ICMR data specifically mentions the prevalence of diets that are high in salt, sugar, and saturated fats.
Yeah.
We all have a sense these kinds of foods aren't the best for us in the long run, and it sounds like they're definitely playing a role in this increasing cancer picture as well.
Absolutely. Diet is, a critical factor that we can actually modify.
Right.
A
Hmm.
consistent pattern of consuming foods that are high in those elements can contribute to chronic inflammation, obesity, other metabolic disturbances in the body, all of which have been linked to an increased risk of several different types of cancer.
Hmm.
So it's not just about, immediate effects like weight gain. It's about the sustained impact on our cells and overall health, over many years.
So when we look at it all together, it seems to be a combination of factors at play. We're getting better at detecting cancer, people are living longer, and crucially, our lifestyle and dietary choices are significant contributors. It paints a picture where, while part of the increase is due to our improved ability to find cancer, a significant portion is likely linked to how we are living our lives.
That's a really accurate and important way to summarize it.
Yeah.
It highlights that this isn't a simple issue with a single cause, and therefore addressing it effectively will require a multi-pronged approach that tackles everything from, improving healthcare infrastructure and diagnostic capabilities to actively promoting healthier lifestyles across the population.
Speaking of addressing the issue, it's encouraging to see that the government is taking this seriously and
Yeah.
planning some pretty significant interventions.
Yeah.
There's this nationwide screening campaign that was planned between February 20 and March 31, specifically targeting individuals over 30 for cancer as well as other non-communicable diseases. And the stated goal is incredibly ambitious. 100% screening, that's a massive undertaking on a national scale.
It is a truly ambitious goal. And the sheer scale of, attempting to screen such a large segment of the population is noteworthy if successful. It has potential to lead to the early detection of a substantial number of cancer cases, which could significantly improve treatment outcomes and overall survival rates. The logistical challenges will undoubtedly be considerable, but the intent to proactively address this is certainly commendable.
And beyond just screening, there's also a really significant push to increase the number of daycare cancer centers in district hospitals.
Oh, okay.
The plan is to establish 200 new ones, adding to the 372 that are already in operation.
Yeah.
The idea, as I understand it, is to decentralize cancer care and make it more accessible to people, particularly those living in more rural areas, so they don't have to travel vast distances to get the treatment they need.
That makes sense. And this expansion of daycare cancer centers is a really crucial step towards improving access to essential care. By strengthening the network at the district level, the government aims to alleviate the burden on the larger tertiary hospitals in major cities and bring cancer treatment closer to where people actually live. This can be particularly impactful for individuals in underserved areas who often face Significant financial and logistical barriers when trying to access specialized medical care in urban centers.
Right.
Reducing travel time and associated costs can make a tangible difference in their lives and their ability to receive timely treatment.
So on the one hand, we're faced with these concerning statistics that you shared with us about the rising number of cancer cases. But on the other hand, we're also seeing these significant efforts being made to improve early detection and make treatment more readily available.
Yeah.
It almost feels like a race against time.
It does have that feeling, and it really underscores the importance of having a comprehensive strategy that addresses both ends of the spectrum, both preventing cancer where possible and ensuring that when it does occur, it's detected early and treated effectively.
Right.
These two approaches really need to work in tandem to make significant impact on the overall cancer burden.
As we start to wrap up this deep dive into the data you provided, really brings the focus back to each of us as individuals. While it's important to understand the role that improved diagnosis plays in these rising numbers,
Yeah.
the influence of our daily choices, what we eat, how active we are, whether we smoke or drink excessively, seems to be a really undeniable factor in our personal risk.
Yeah, and that's a key insight for everyone listening.
Right.
While large-scale initiatives and advancements in medical technology are absolutely vital individual responsibility, and the choices we make every day have a profound impact on our long-term health and our susceptibility to conditions like cancer. Our lifestyles are a significant piece of this complex puzzle.
So perhaps this is a good moment for a bit of honest reflection for all of us.
Yeah.
How healthy is our diet really?
Right.
Are we getting enough movement into our day? How effectively are we managing stress?
Yeah.
These aren't just general health recommendations. They seem to be directly connected to these very real and concerning cancer statistics that you brought to our attention.
Exactly. It's about, making informed choices and actively taking steps to prioritize our own well-being,
Right.
This isn't about assigning blame or creating guilt. It's about empowering each individual with the knowledge that they have agency and can make choices that influence their own health trajectory.
And while the government's efforts with these ambitious screening programs and the expansion of treatment centers are certainly positive and necessary steps,
Yeah.
it feels like we as individuals also need to step up and take ownership of our health. Maybe it's time to actually take advantage of those screening opportunities if we're eligible. Maybe it's time to really think twice before lighting that next cigarette or reaching for that extra portion of processed food.
Precisely, collective action, both at the governmental and individual levels, is really essential if we want to effectively address this significant health challenge. One without the other is likely to fall short of making the kind of impact that's needed.
It really leaves you thinking, doesn't it?
It does.
These numbers aren't just abstract data points on a chart. They represent real people and real lives. And while the big picture can sometimes feel overwhelming, perhaps the most powerful thing each of us can do is focus on those smaller, everyday choices that could potentially shift our own personal odds and contribute to a healthier future, not just for ourselves, but for the wider community.
Absolutely. I completely agree.
Well, thank you so much for bringing this to our attention
My pleasure.
and for this deep dive into such a critical issue.
Yeah, thank you for having me.
It's been really eye-opening.
It has been.
We'll be sure to keep our listeners updated on any new developments in this area.
Great.
And as always, thanks to all of you for listening.
Yeah, thank you, everyone.
We'll catch you next time.
See you later.